Hi everybody, Dr. Kazi over here at Kazi Cosmetic Clinic in Irvine, California. And today I'm actually doing a few different treatments for this patient. She has some volume loss in her mid-cheek area, and we also have some acne scars. You can see that they're actually tethered. What I mean by that is when you pull on the scar, you can see as it stretches with the skin. So that means it's tethered, and we actually need to break up those little tethered areas where it's stuck. So I'll do a little subcision. And then what I'm going to do is I'm actually going to place the longest lasting filler that's currently on the market called Bellafill. It's actually made out of cow collagen and these tiny little crystals that stimulate your own body to actually make collagen in that area. So you'll see as I do this over here, I'm going to actually do a few things here. I'm going to go underneath the scar. This is this scar right here I'm going to target. I'm going to break up that scar tissue a little bit here. So we're breaking it up, and then we're going to actually place that Bellafill directly underneath that scar. And then we're going to do that same process over here as well. So this is just collagen, basically. It's these tiny little crystals. Pushable. You see right here. I'm going to break that scar again. What I mean by tethering is that sometimes it's stuck. We have to break it so that the scar can get released and rise. So scars that work best are those that are really stuck like that. I wouldn't really do something like this for something called ice pick scars. Those really respond better to TCA cross or phenol peels. And other kinds of wide scars usually don't respond as well to this. So this part right here, I'm just actually just breaking up some of that scar tissue right here. Breaking it up right here. You see all along here, you can see these little acne scar marks. And for some of these, I'm just going to place a little bit of filler here. It's a unique kind of filler because it's actually really just collagen itself. And it's the longest lasting FDA approved filler. So again, look at these scars right here. You can see when you pull on the skin, the scar moves with it. See that there? It's stuck. So we have to release these scars. Place just a tiny little bit of this cow collagen called Bellafill. Just tiny micro droplets are what I'm placing. And now what we'll do is kind of support this mid-cheek area here. And you're always moving the cannula. You don't really stay in one space. That's how you can stay safer. So this is really just injecting basically collagen in the area. One of the things to pay attention to when we do these treatments is that you're going to really want to make sure that your acne is under control. So we have to really keep in mind that that's very important. So you'll probably have to be on certain medications and creams to ensure that you don't have excess breakouts then. Part of the reason why you start noticing, some patients say, well, I started noticing my acne scars a little bit more when I started hitting my 30s is because of the volume loss that occurs in your mid-face. Yeah, we're just kind of wiggling and gently going inside of here. You see, I try to never really force myself into certain areas, just have to reposition and try a different way. And now we're going to kind of sculpt her cheeks with this. Long-lasting collagen-based filler called Bellafill. And if you look at one side compared to the other side, you can see how there's a little bit more projection now. It's really helped out our cheekbones. And we're not quite done yet. We're going to do a few other things, basically also going to try to get a little bit more shape here in this mid-cheek area. And then we're going to place a little bit more deep to the bone with radius, which is a calcium-based filler, also stimulates collagen. And that's how I can blend it all really nicely. This is Bellafill to the cheeks. We did it to the acne scars earlier. It's the longest lasting product that's FDA approved. It's a really nice product because it's not too thick, but it tends to blend in really nicely. Look at how we got that nice sharp angle right there. What we'll do is we'll place a little bit of radius now too. Going to go deep to the bone. This does swell up a little bit, but when it goes down, it's going to be really nice. This is how we can really make these cheekbones pop. But more importantly, it helps to also stretch out that scar so that's not as visible, the acne scars. And again, you can see that difference between the left and right side there. Still, this is the most swollen it's going to be, but look at how you can see that shape there. You can see that structure definition compared to a little bit more flat on the right side. And it's not going to move either. The products I'm placing in there really, these are just going to stay where I place them. But we need to do it that way because we need to really get a little bit more pull and projection to our cheeks. So you can see that this side looks a little bit tighter, it's more lifted, and then also it's going to just really help with those acne scars then because it's just kind of pulled it up then. And by slowly retracting, we can minimize bruising. There you go, guys. That's Bellafill and Radiesse together to help acne scars as well as support the volume loss. These are long-lasting fillers to help support these areas. And I'll just do a couple more spots, but we're pretty much done. Thank you, everybody. Thanks for joining us today.